Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Hello viewers, I am Dr. Dev Pahlajani. I am the interventional cardiologist attached to Pehlajani Hospital of Mumbai for over last more than 3 decades. I have witnessed the beginning of the outbreak of COVID-19 in the city as well as in the country. It has been an unfortunate sort of a pandemic which has taken up over many lives. If you see what has been happening all over the world, India and the city of Mumbai, it is really pathetic. If you count the numbers, more than 9.5 million individuals have been affected worldwide, and with 500,000 deaths. India, which is fourth in the line of the numbers, has got 500,000 cases and 15,000 deaths. Unfortunately, my own state and the city has been in the forefront in the numbers, and more than 150,000 individuals had contracted the COVID-19 disease, and more than 3,500 deaths. And if I look at the hospitals all around, and many of my friends, many of my colleagues keep on calling me whether there's a bed available or not, and when I call the hospital, and it's very unfortunate that one can't get the bed, because it has so happened the number of cases that are sort of coming into the hospitals getting the symptoms of COVID, which are hacking, dry cough, chest pain, breathlessness, and fever. And they are in search of a bed, and unfortunately, beds are in short supply because nobody expected such kind of a pandemic to engulf the world, and particularly our city, which actually has not many facilities to sort of even cater to the normal sort of a number of patients who come with the usual or the lifestyle diseases, diarrhea, dysentery. And suddenly you got such an explosion of numbers that the beds fall short. So much so that the beds are being put into the open grounds. Like if you see the our rest track, you see the MMRDA ground in BKC area, and see the dome in the NSCI. They have been all converted into the observation centers or the quarantine centers, and therefore the patients get admitted there. They have become bad, they become serious, they are shifted to the hospital. It's a very difficult to get. Unfortunately, again, our another important city, the capital of the country, New Delhi, is taking over the numbers from Mumbai. The numbers are increasing, and so far as I saw it today, the numbers of Delhi are far more than that of Mumbai. But these are not the numbers which we enjoy, which we really feel that sorry that such a thing has been happening to the human beings in this world. Now, if you see that such a number is coming up, patients are suffering, patients are dying. So what is the science and the medicine doing to treat these patients? Unfortunately, this kind of a virus was never imagined. Nobody imagined such a thing. I remember about 4 years back, Bill Gates had actually predicted that one day human beings may encounter such a pandemic. So are we ready for such a pandemic? It was not only Bill Gates. I've seen the speech of past President Obama, who also had suggested or maybe predicted that such a pandemic may affect all of us one or the other day. Then are we ready for this? Unfortunately, I must say that all these years, the healthcare authorities have been sort of devoting their time, energy, money on the lifestyle diseases. If I see my own career, I see, at no time the money was earmarked, money was not diverted to the kind of an epidemiology. I don't see anybody who's expert in epidemiology. I see on the net when the people who are being interviewed to talk about the COVID-19, I see cardiac surgeons coming and talking about it. Actually, it should be the epidemiologists who should be discussing them, who should be guiding the country's healthcare givers and the powers that be at the center. It is actually who's being contacted or the cardiac surgeons, because we never spend time, money, energy on developing the science and the medicine of the epidemiology, as well as for the as far as well as the communicable diseases. So therefore, we have so far neglected these diseases, and then once such a disease has sort of come in front of us, we find ourselves to be totally lost. All the same, I must say that the research to find cure and vaccine for this dreadful disease somehow the other has gone on with a breakneck speed, and no other disease has attracted so much of attention, money, energy to see that we come out with some tangible solution of treatment to this dangerous disease, to see the human lives are saved. And in this such a kind of a hurry to get some drugs and some methods to treat this disease, I must say that in these 4 months' time, we have been able to find out some medicines, some drugs which will help, if not completely cure the disease, because at the moment there is no disease, there is no drug which can kill the virus. It can only reduce the virus load in a given patient. So, despite there being no specific cure, there are several drugs and therapies that have been shown to improve outcomes by reducing the viral load and, and widespread, sort of controlling the widespread inflammation. After all, when the virus comes into the body, human body, there's an acute inflammation. There's an acute inflammation. There is a occlusion of the vessels, small vessels. The lungs get affected with the pneumonias, so much so that now CT has become an important diagnostic tool to diagnose COVID-19. Even before we take the throat swab, we take the nasal swab. CT has become a very, very important source of investigation and diagnosing a COVID-19 disease. So this causes a widespread inflammation. So there are a lot of drugs which are being tried, which can reduce the viral load, control the acute inflammation, and also, since there's an acute inflammation, there's a thrombotic milieu in the body, and therefore we have been able to use some drugs which are known to reduce the thrombotic load in the body. Now, there are various methods which have been sort of put into practice to treat this disease. Very sort of attractive way to treat this was that suppose if a patient got the COVID-19, being a viral disease, naturally it will produce antibodies. So suppose a patient who got infected with COVID-19, and recovered, is convalescing, and we took out his antibodies and gave to another patient who is suffering. Maybe these antibodies will neutralize the viruses into the person who's going to be affected and therefore will treat it. There are a lot of centers which have been trying this plasma of convalescing patients from the COVID, patients who have been treated, who are recovered. These patients have been given these plasma antibodies. However, the results have been plus minus, have been equivocal disease. There are some drugs which have been used and which have come out into the market, about which I will talk about a little later on, which has shown a considerable success. While we talk about the specific drugs, we talk about the antibodies, we should not forget that these patients are very sick. They develop symptoms like flu, but a very severe flu. And therefore, in these patients, the best thing is either if they've got mild symptoms, they are usually quarantined at home. If they are moderate to severe symptoms, they are shifted to the ICUs into the hospitals. Now, once they come into the hospitals, they are given general measures like good nutrients, fluids, careful monitoring. They are kept quarantined so that they don't mixed up with the normal people. Very important to see that once their oxygen saturation goes down, they are given oxygen, they are put on ventilation in case they develop respiratory distress. And to treat inflammatory storm, we give them, and actually we Indians in Indian hospitals, we have been giving them steroids right from day one. And then because there's a thrombotic milieu, as I said before, we give them heparin because several patients of COVID-19 have been known to die of pulmonary embolism. So they have been given heparin to treat this pulmonary embolism. The measures are all general measures, but there are certain specific drugs which have come in the market, which are mainly the antiviral drugs which reduce the viral load. Very or popular drug which everybody is reading in the newspapers, in the media, is a drug called remdesivir. The drug has been developed by a pharma company called Gilead, and it was originally used for hepatitis C, and later it was used for Ebola and the MERS virus. The drug is administered by the intravenous infusion. The dose is 200 milligrams on day 1, followed by 100 milligrams to be given for 5 days. And fortunately, the drug has shown that it sort of improves the recovery, faster recovery by 31%, and the recovery time has been reported to be reduced from 15 to 11 days. There has been no talk about whether it has reduced the mortality or not. There's no talk on that. However, there's definitely a faster recovery and the reduction in the number of days that the patient lives in the or stays in the hospital. The drug was first in the beginning touted to be given for 10 days. However, recently there has been data in the New England Journal of Medicine in which the trialists compared the 5 days treatment versus 10 days treatment. And it was found that if you gave the drug for 10 days, the mortality and the outcomes were worse. So therefore, the recommendation currently is not to give for 10 days. To give for 5 days, it has got a better outcome as compared to the 10 days. The drug is actually adenosine nucleotide analog, and its active metabolite is a prodrug. Its active metabolite interferes with the action of RNA polymerase, and it evades the proliferation of virus and thus reduce the viral load. It has some side effects because ultimately any drug of that powerful effect has to have some side effects, and one has to be look out for that. Renal failure, organ dysfunction, low albumin, low potassium, and low blood counts. Then the drug therefore should not be given in patients who got a renal failure or a hepatic failure or even the pregnant woman. And a very good and encouraging news is that the drug generic form of the drug now is being manufactured in India by the Hetero Lab of Hyderabad, and very soon I'm told that the drug is going to be marketed, or generic is going to be marketed by Cipla company, and the drug will be available at much cheaper price. At the moment it is being made available at 5,400 rupees, but I'm told that it will be available at 5,000 rupees. The drug which is available in Indian market at present is called as Covifor, Covifor. Another drug which has been now in market which is marketed by the Glen Pharma, and the drug is Favipiravir and is marketed as Fabflu. And the drug is supposed to be used only in mild to moderate cases. The drug also has shown to reduce the virus load. If you see the drug's history, the drug was originally developed in Japan and it was recommended to be used for cases of flu. However, when the Chinese outbreak took place 4 months back, there were two Chinese trials, and one tried about 80 patients, another trial used more than 300 patients, and they found that there was a quick reduction in the viral load as compared to the other drugs, other antiviral drugs, lopinavir and ritonavir. And Japan also tried this drug, and there was actually much larger numbers, and they had some 2,141 patients who were treated with the favipiravir, and they found that the outcomes were better when compared with the conventional drug. Currently, Glenmark is conducting a trial, and I'm told the trial is over. However, I have not seen the data being published so far in any of the peer-reviewed journal. The dose recommended, it comes in the strips tablets, and the dose recommended is to give 1800 milligrams twice a day on day 1, and to give 800 milligrams twice a day for next 14 days. Some of the earlier drugs, one of the earliest drug which was actually touted about 3 months back, and one should not even quote, but I would like to quote the President Donald Trump in one of his press briefing, touted that the drug like chloroquine or hydroxychloroquine will be very effective in treating the coronavirus, COVID-19. But however, several trials have shown that chloroquine or its analog hydroxychloroquine have no effect in reducing the mortality, reduce or improving the outcomes in patients who have got COVID-19. As a matter of fact, the WHO has removed chloroquine and hydroxychloroquine from the Solidarity trial, which is testing several drugs for the treatment of COVID-19. The drug also has been removed from the recovery trial, which is a UK trial, which is also trying multiple drugs in the patients with COVID-19. There are some new drugs which are in the pipeline, and one of them is sarilumab, which is a drug which is being put into trial by Sanofi. His results are still awaited, but I'm sure in another few months we should have the data will be available. There are other drugs which have shown some improvement and in the in vitro studies, and one of the drug is ivermectin, and it has been shown to inhibit the replication of virus by 5,000-fold. So if it really proves to be good in vivo, because this is only a vitro study, so therefore if it is found that it is effective in vivo, maybe it will also hold a promise, but the data is not available for in vivo. Whatever is available is in vitro study. There are two large-scale trials which are called as recovery trial, which is the UK trial, and there is a the other one is a multinational 45 degrees trial, which is testing various drug called as a solidarity trial. Now, in the uh, solidarity trial, the, the investigators are testing several drugs, but let's look at the recovery trial first. The recovery trial is a UK trial in which drugs like lopinavir, ritonavir, and azithromycin and tocilizumab, which is an anti-inflammatory drug, they are being tried. What was very, very helpful was their observations, earliest observation on dexamethasone. They found that those patients who were on ventilators, when given dexamethasone in the beginning, when they were on ventilators, 6 milligrams twice a day, the death rate was reduced by 35%. And but it did not help the patients who are not on ventilator. So remember, its use is only for the patients who are on ventilators but not on ventilators. So its recommendation, the recovery data recommendation from UK is that those patients who are on ventilators, they should be given dexamethasone. Now, as I said in the beginning, we in India, in my hospital, I talk to my residents. They say, sir, we have been giving equivalent of dexamethasone, which is solimetrol. They have been giving solimetrol, which is nothing but a steroid. We have been giving right from day one. So we have been actually been wiser, I should say, that we have been giving these patients steroids because we realize that ultimately it is a generalized inflammatory disease. Virus causes a generalized inflammatory disease, so you need an anti-inflammatory agent. So we thought that the most important drug, one of the most important drug, will be to give them steroids to tide over the generalized inflammatory status. In the solidarity trial, uh, the drugs that are being tried are the uh, are the remdesivir, lopinavir, ritonavir are being tried, and the data will be available maybe in another 3 months' time. This is a multi-center, multi-country trial. The other thing that is happening around the corner is the vaccines. Now, since at the moment there is no specific drug that can cure the COVID-19, I think everybody ultimately it goes logically. Every viral disease, and from beginning on, right from smallpox days, measles days, the chickenpox days, we have always looked at the vaccine. So it goes without saying that when such a disease occurs, the next thing or the first thing, right? First thing that we should be looking at is vaccines. There are several vaccines which have been sort of touted by various companies, and I'm told there are 120 vaccines waiting for the trial or development. But as of now, as I see the literature, there are about 22 vaccines they are in the pipeline. But the one which is probably is winning the race is the one which is developed by Oxford, and it is being tested by AstraZeneca. And it seems to be having an edge in the trial because now they have enrolled about 30,000 individuals who will be given the vaccine, and their data will be available in 3 to 6 months' time. And we should be very proud as Indians, we should be very proud and happy that in the world's largest manufacturing unit from Pune, that is the Serum Institute of India, is one of the main collaborator. And as I hear on the net or I hear on the television, they have already started manufacturing the vaccine, leave aside testing, and but they already started manufacturing the vaccine. And if the results become available by August or September, I'm sure by the end of the year we should have the vaccine with us. How much vaccine will be effective? There are good chances because ultimately this virus is stable. It has been found that the virus does not mutate. If mutated like the virus of HIV, then it becomes difficult to develop a vaccine. But in this case, the virus genetic code is very stable. So therefore, once it is stable, does not mutate. So it is very likely that we will have vaccine. But how much antibodies it will produce and how much efficacy will be there in the body to fight a coronavirus? Will it be 6 months, 1 year, permanent, just like we take a smallpox vaccine or we take a polio vaccine? We have got a lifelong immunity. Is this going to be a lifelong immunity or is it going to be a temporary immunity? That we will know only after the vaccine comes in the market. One more good thing about the Indian market for the vaccine, as I heard, if I heard right, the Serum Institute of India's owners and the people who are involved there, that the vaccine in India will be available for 1,000 rupees. I think that's very encouraging, and that's, I should say, is helping the people at large, masses at large, to see that the coronavirus is sort of a conquered, and we should be much better. Now, the last thing that I want to talk is prevention. Is there any treatment for prevention? As of now, as I see it, there is no specific drug to prevent the coronavirus. At the moment, what is available is social distancing, mask, hand sanitization, sanitize your all the surroundings, live in the surrounding which are sanitized. I think that's the only way to prevent the COVID-19. Therefore, this is a nutshell which I've told you. I'm sure when we talk again, maybe in another 2 weeks or 4 weeks time, if you have an opportunity to again talk to you, I'll possibly come back with a much better sort of a drugs, much better, which will give much better outcomes, save lives, and maybe there may be a drug which will come for prevention of the COVID-19. And if we talk a little later on, maybe in September, October, maybe we will have a vaccine to treat and prevent the COVID-19. Thank you very much for listening, and I thank the TheRightDoctors.com, which is India's leading medical knowledge platform, which has brought in this knowledge to all of you. Thank you very much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.